Welcome to Learning Anatomy with Dr. Bakare. And if you are visiting my channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the scapula. To try to use this image by the side, this is where we have the scapula here, harrowed in black. The scapula is a flat triangular bone that is located at the posterior lateral region of the trunk. If you try to extract it, this is the kind of configuration that you would see. You see that it is a triangular flat bone. In this lecture, we would be dwelling on the details of the different sub-regions of the scapula, and we would be highlighting the different muscles also that are related to it. The scapula is also referred to as the shoulder blade, and it is a triangular flat bone that is located at the posterior lateral region of the trunk. This we have highlighted in our previous slide. We try to use this lower image. This is where we have the scapula here, harrowed in red, seen with a number of irregular projections. If you try to use this upper image here, you see that you have a number of projections here on the scapula harrowed in black. We will be dwelling more on this as we go through with this lecture. The scapula extends from the second to the seventh rib. We try to use this lower image. This is where we have the second rib, and if you count it downwards, this is where we have the seventh rib, and it structurally forms part of the shoulder girdle. If we try to also go back to this lower image, this is where we have the clavicle. The clavicle and the scapula together form the shoulder girdle. The shoulder girdle is an incomplete circular ring that is seen around the shoulder region. It is the shoulder girdle that creates the connection point for the upper limb. So you see that around the lateral region of the scapula create an indentation that receives the head of the humerus. This is the humerus here, and at this point, the head of the humerus fits with the indentation that is referred to as the glenoid fossa located around the lateral region of the scapula. And at this point, we have the creation of the shoulder joint. So you see that the shoulder girdle creates the attachment point for the upper limb. The scapula is also seen to connect the axial skeleton to the appendicular skeleton. If you look at this region up here, this is where we say we have the clavicle. We say that the scapula connects with the clavicle, and it is through the connection that it creates with the clavicle that it connects with the axial skeleton. We know that the axial skeleton is made up of the skull, the vertebral column, and also the rib cage. This is the rib cage here in the anterior region. So you have the scapula connecting to the axial skeleton, specifically the rib cage, through the clavicle. The clavicle at this point is specifically connected to the sternum. We know that the sternum forms the anterior midline region of the rib cage. So it is through the clavicle that the scapula connects with the axial skeleton. And it is seen to also link this connection to the appendicular skeleton. At this region here, we have the humerus. The humerus, which forms part of this appendicular skeleton. So you see that the scapula is like an intercept, creating a link between the axial and also the appendicular skeleton. If you look at the orientation of the scapula around this medial region that is harrowed in dotted green, you see that it is not creating structural connection or articulation with any bone. So at this region, it is free. Because of this free presentation that it creates around this region, is where it's able to allow for a wider range of movement of the upper limb. If you look at this lateral region, this is where we say it is connected to the humerus. And because of this freeness that it creates around this region, this free allowance that is created around this medial region is also impacted on the scapula, where it is connecting with the humerus. And this is where it allows for a wide range of movement of the upper limb. So if you try to compare the movement of the upper limb with that of the lower limb, you see that the upper limb exerts a wider range of movement because of the free will that is created around the medial region of the scapula, which is also impacted on this lateral region where it is connecting with the humerus. So it's important that we highlight this. And this is where the presentation of the scapula around this medial border is also exerted on the function that it exerts on the upper limb. So let's drive through the functions of the scapula. The scapula is seen to connect with the clavicle, and this is where it creates the shoulder girdle. This shoulder girdle, we say that it is an incomplete circular orientation that creates the attachment point for the upper limb. We've tried to describe this in our previous slide. So the scapula creates the connection point or articulation point for the upper limb. So this is one of the functions that are attributed to the scapula. And at this point, it also exhibits a wide range of movement. And we've tried to justify this in our previous slide, that the wide range of movement that is exerted by the upper limb is attributed to the fact that the scapula around its medial border is free. Because of this free will or free allowance that is created around this medial border, it is exerted also on the lateral edge where it is connecting with the humerus. So it is not only creating a structural articulation point for the humerus, which is a structural component of the upper limb, it is also helping to contribute to the wider range of movement that it exhibits. This is where we have the clavicle, creating a connection point with the scapula to form the shoulder girdle. And at this point is where we have the humerus, where it is fitting into the glenoid cavity of the scapula. And this is where it is creating the shoulder joint. The second function is that it creates the attachment site for muscle. By the time we go through with this lecture, we would be highlighting the different muscles that are related to the scapula. These muscles are either seen to pad up the surface of the scapula or are seen to connect from one region of the body to the scapula. And this is where you see that the scapula is creating an origin or insertion point for this muscle. It also creates the passageway for neural vessel. Also, by the time we go through with this lecture, we'll be highlighting the specific region of the scapula where we have the creation of a passageway for neural vessel. Let's look at the articulation points or joints created by the scapula. The scapula forms the glenohumeral joint and also the acromoclavicular joints. If we try to break down the name, as I've always said on this channel, the glenohumeral joint is a joint that is created between the glenoid cavity of the scapula and also the humerus. And this is what is harrowed there in green. So you see that at this point, you have an indentation created around the lateral edge or border of the scapula that is referred to as the glenoid fossa. This glenoid fossa is an indentation, and this is why it is able to fit into the rounded head of the humerus. And at this point, we have the creation of the glenohumeral joint. And this is the humerus here, arrowed in black. And we also have the acromoclavicular joint. This is the acromoclavicular joint, arrowed in yellow. So if you try to break down the name, acromioclavicular joint, acromion is the projection that is seen on the scapula. And it is through this projection that it receives the clavicle. So you see at this point, you have a joint created between the acromion of the scapula and also the clavicle. And this is referred to as the acromoclavicular joint. And this is what is harrowed at this point. This is where we have the clavicle here, harrowed in black. So you see that it creates a joint with the clavicle and also creates a joint with the humerus. So now let's go to the structural orientation of the scapula. Scapula is seen to have two surfaces, three borders or margins, three angles, and also three processes. So for the surfaces, the scapula has the anterior or the postal surface and also the posterior surface. We try to use this image at this lower side. This is the anterior view of the scapula, and this is the anterior surface. This can also be referred to as the postal surface. We try to use this other image by the side. This is the posterior view of the scapula, hence this is the posterior surface. So you see that it has a surface in the anterior plane and also another surface behind. Then for the borders, it has three borders or margins. It has the medial border. If you try to go back to this image, this is where we have the medial border here, harrowed at this point. If you try to place the scapula in an anatomical position, you see that this is the medial border. And at this lateral region is where we have the lateral border or the axillary border. It is axillary border because it is related to the axilla. Then we have the superior border at the superior edge. If we go back to when we started this lecture, we said that the scapula is a triangular structure. Because it is triangular, it is expected to have three borders. So this is the borders as we have highlighted. Then it has three angles. It has the superior angle or the medial angle. This is where we have the superior angle here, carried at this point. And this is also referred to as the medial angle. Remember when we described the borders, we said that this is the medial border. The superior angle is related to the midline plane, and this is why it is also referred to as the medial angle. This is the inferior angle harrowed at this inferior region, and this is where we have the lateral angle at this lateral side. So for the processes, we have three processes. We have the spinous process. The spinous process is seen at the posterior region of the scapula. And if you try to use this image by this other side, this is where we have the spinous process of the scapula. Then laterally, we have an expansion of the spinous process, and this is the acromion process. Then in the anterior region behind here, we have the coracoid process. This coracoid process is like a pig or a hoop that extends around that region. If you try to use this other image of the anterior view of the scapula, this is where we have the coracoid process here, harrowed in black. It is more seen in the anterior region. While behind here, we have the acromion process. Remember, the acromion process is the lateral extension of the spine. So the spine is seen behind, it cannot be seen here in this image. In the posterior view here, it can't be seen. So these are the surfaces, the borders, angles, and also processes of the scapula. We would be driving into each of these that we have highlighted, and we'll be establishing the different muscles also that are related to the different sub-regions. So first, let's look at the surfaces, and here we'll be looking at the anterior surface. The anterior surface is the region that faces the rib cage. We try to use this upper image. This is the anterior view, hence this is the anterior or the costal surface. If you drive down to this lower image, this is the rib cage, and at this region that is harrowed here in hash is where we have the scapula. We said that the scapula is located at the posterior lateral region of the trunk. So it is located behind but placed laterally. And this is what is highlighted here in red. If you look at it, you see that there is a surface of the scapula that is directly connected to the rib cage. So this is the anterior or the costal surface. And it is costal because it is related to the rib. Rib is costal. So this is why it can also be referred to as the costal surface. This surface presents a large concave depression. If you look at this upper image, you see that there is an indentation or a depression created around this region. And this is referred to as the subscapular fossa. This subscapular fossa is seen to be filled with the subscapularis. We have a muscle that is referred to as the subscapularis that fill up this indentation that is created in the anterior region. So in case we are asked during examination that what muscle is related to the anterior surface of the scapula, we should know that it is the subscapularis muscle. This muscle is seen to extend from this region, and the fibers are driven and directed onto the lesser tubercle. So this is where we have the lesser tubercle here, harrowed at this point, around the proximal edge of the humerus. This is the humerus. So you have a tubercle created around this region, and this is the lesser tubercle of the humerus. This is where the fibers of the subscapularis muscle will finally be inserted upon. At this lateral region, we have greater tubercle. But just for us to know that where specifically that the fibers of the subscapularis muscle will be inserted upon is the lesser tubercle of the humerus. And this is what is projected here using this image. So now let's go to the posterior surface. We say that the posterior surface is the surface that is located behind. Using this upper image, this is where we have the posterior surface. So this posterior surface is seen behind. We try to use this lower image. Remember, we said that this structure that is highlighted in red is scapula. We already described the costal surface or the anterior surface. So behind this surface, at the posterior region is where we have the posterior surface. And if you try to view this posterior surface, this upper image is the kind of presentation that you see. You see that it presents a convex alignment. If you go back to the anterior or the costal surface, remember we said that there is a depression created. So this depression is what is creating the convex presentation around the posterior region. So if you have a push in the anterior region, you should have a convex presentation at the posterior region. And this is what is projected here. So if you place this scapula in an anatomical position, this is the medial region and this is the lateral region. If you drive deep into the posterior surface, we have the spinous process, which is also referred to as the spine of the scapula. And this is what is harrowed here in red. So you have an horizontal or transverse projection around the posterior surface of the scapula. And this is what is harrowed here at this point. This projection, because it's transverse, you then see it dividing the posterior surface into the supraspinous fossa and also an infraspinous fossa. This is the supraspinous fossa here, harrowed in green at the superior region. This fossa is seen to be smaller, and it is smaller because at the point where the emergence of the spine occurs is more at the upper edge. And this is where it is creating an uneven division of the posterior surface. And this is the infraspinous fossa located at the lower region here, which of course is larger, as you can see. The supra and the infraspinous fossae are seen to accommodate also different muscles. So for the supraspinous fossa, we have the supraspinatus muscle, and the infraspinous fossa is seen to accommodate the infraspinatus muscle. So you see that they have different muscles also within this space, helping to pad the surfaces of the scapula. Remember, we said that the scapula, when we try to highlight the functions of the scapula, we said that it creates attachment site for muscle. And this is where it is helping to pad up the scapula itself. So these are the muscles that are seen on the surfaces of the scapula. The supraspinous fossa and the infraspinous fossa are seen to connect through the spinoglenoid notch. If you look at this region that is harrowed in red, there is a space created around the base of the acromion process and also the glenoid ring. And this space is what creates the connection point between the supraspinous fossa and also the infraspinous fossa. So there's actually a connection point between the supraspinous fossa and also the infraspinous fossa. And this is through the spinoglenoid notch that is harrowed here in red. It is also important for us to highlight the insertion point of the supraspinatus and infraspinatus muscle. Remember, we said that these muscles are embedded within the supra and the infraspinous fossa. If you look at this upper image, this is the fiber here running, and you see that after being embedded within the supraspinous fossa, it is seen to be directed laterally, where it is inserted on the greater tubercle of the humerus. So also this presentation is exhibited by the infraspinatus muscle. The infraspinatus muscle here that is also highlighted in dotted blue is also seen to be inserted on the greater tubercle of the humerus. Remember our previous slide when we described the subscapularis muscle that is embedded within the subscapular fossa. We say that the fibers of this muscle will finally be inserted on the lesser tubercle of the humerus. While at the posterior region, where we have the supra and the infraspinatus muscles, we have these muscles inserted onto the greater tubercle. So it's important for us to be able to highlight the distinct point where the fibers of these muscles are inserted upon. On the anterior region, where we have the subscapularis, it is inserted on the lesser tubercle of the humerus, while posteriorly, where we have the supraspinatus and the infraspinatus muscles, they are inserted on the greater tubercle of the humerus. Remember, this is where we have the lesser tubercle. In between the two tubercles, we have the intertubercular groove, and it is this groove that creates the accommodation point or site for the long head of the biceps brachii muscle. We will be highlighting this when we get to the muscular component of the arm. Please do watch out for this. It is also important for us to add that the spine becomes transformed around the lateral region into the acromion. This is where we have the acromion here, harrowed in purple. This acromion is a lateral extension or expansion of the spine. Remember, this is the spine here, harrowed in red, creating an uneven division of the posterior surface of the scapula. We've tried to highlight this during the course of this lecture. So as the spine drives laterally, you see that it becomes enlarged and becomes transformed into the acromion. And this is what is harrowed at this point. This acromion is seen to arc over the glenohumeral joints. Remember our glenohumeral joints that we say occur between the glenoid cavity of the scapula and also the humerus. This is what creates the shoulder joint around this lateral region. So you see that the acromion is seen to be arcing over it. And this is where it is helping to provide structural support for this joint. It is also seen to create the articulation site or point for the clavicle. This is where we have the clavicle here highlighted in ash. We know that the clavicle is located in the anterior region, and the acromion extending from the lateral region or expansion of the spine is seen to drive in further to the front, where it will be creating a connection to the clavicle. and the point where it connects or articulates with the clavicle is referred to as the acromioclavicular joint. Remember, all we need to do is to always break down the name. Acromioclavicular joint is the joint between the acromion of the scapula and also the clavicle. So this is what is created here around this point. This is where we have the clavicle here highlighted in hash, and you see that it creates an articulation point here with the acromion. So using this lower image, this is where we have the projection here that is referred to as the acromion. The acromion is the lateral extension of the spine, as we've highlighted. And you see it from the posterior region. It's trying to create a link with the clavicle in the anterior region. This is the clavicle here, carried in red. And at this point, you see that they create acromioclavicular joint. So it is through these joints that the scapula is able to connect with the exoskeleton. Remember, we tried to describe this in our previous slide. It is also important for us to add that the surface of the spine and also the acromion is related to some muscles. If we go back to this upper image, this is where we have the spine. So that the spine will drive laterally to become expanded, and this is where it becomes transformed into the acromion. At the lower border of the spine and also the acromion, you have the deltoid muscle. We know that the deltoid muscle is the muscle that creates the rounded or the contour around the shoulder joint. And this is where it has a relation also with the scapula. So it is specifically seen at the lower border of the spine and also the point where the spine becomes transformed into the acromion. We have the upper region here, we have the trapezius muscle. The trapezius muscle is the muscle of the back, and you see it extending and finally creating an insertion point here at the upper region of the spine and also the acromion. So you see that the spine and the acromion at the lower point and also the upper point, they have different muscles that are related to the specific regions. So having highlighted the anterior and the posterior surfaces and also describing the different muscles that are related to the specific regions. Remember, we already described that the scapula has three borders. We have the medial border, we have the lateral border, and we have the superior border. Now let's go to the medial border. Using this lower image, this is where we have the scapula here highlighted in red. And this region where this arrow is pointing is the medial border. This medial border is the longest and is seen to run parallel to the vertebral column. If we go back to this lower image, this is where we have the alignment of the vertebral column here where this arrow is pointing. And this medial border is what creates a parallel orientation also with the vertebral column. And this is why it is also referred to as the vertebral border. It is important for us to know how these names are drafted. If you try to use this upper image, this is where we have the alignment here of the medial border or the medial margin that is highlighted in dotted blue. This is what is arrowed at this point. And if you use this lower image, this is where we also have the medial border. You see that this medial border is related to the vertebral column, and this is why it is so also named the vertebral border. This medial border extends superiorly from the superior angle here down to the inferior angle. So you see it extending from the superior angle up here down to the inferior angle. And if you look at it, there is a point where we have the emergence of the spine. This is what is highlighted here in red. Above this region, the alignment of the medial border runs an obtuse angulature. So the region of the medial border above the emergence of the spine is seen to present a curvature. So you see an obtuse angulature created around this upper region. The medial border is not seen to connect with any bone. And this is why we say that it is free around this point. If you try to use this lower image, this region where this arrow is pointing is where we say is the medial border. And if you look at it, you see that it is not articulating with any bone. If you go to the lateral border here, this is the point where it articulates with humerus. But on this medial border, it is free. Because of this free will, it is able to impact also on the lateral border where it is connecting with the humerus. And this is where it is able to allow for a wider range of movement. That is why you see that the upper limb exhibits a wider range of movement. It's because of the freeness that is created around the medial border, which is also impacted also on the lateral edge where it is connecting on the upper limb. This medial border is also seen to create the attachment point for muscles. We have different muscles attached on different points of the medial border. Before we dive into highlighting the specific sub-regions of the medial border and also the muscles that are related to them, it is important that we highlight that the medial border has an anterior lip and also a posterior lip. these anterior and posterior leaves give attachment to different muscles. For the anterior leaf, it will be easy for us to project this using the anterior surface, while the posterior leaf, it will be easy for us to show the different muscles using the posterior surface. So this is the anterior surface of the scapula, and this is the posterior surface of the scapula. Remember, we already described in details the specific features, so the muscles that are related to the anterior and the posterior surfaces. So for the anterior surface, this is where we have the medial border, and in the anterior lip here, we have it related to the serratus anterior muscle. This is the serratus anterior muscle here, highlighted at this point, but it is specifically attached or connected to the anterior margin or region of the medial border. And this is what is projected here in this image. Let's use this image by the side to now describe how the serratus anterior muscle runs. The serratus anterior muscle is what is highlighted here in this image. And you see the fibers emerging from the ribs and are directed posteriorly, which they will be inserted on the anterior lip or anterior margin of the medial border. And this is what is expressed here in this image. And this is why you see it in the anterior region of the medial border. And if you go back to this image, you see that it is actually attached to the anterior margin here as projected in this image. And if you go back to the anterior surface, we say we have an indentation that is created, which is referred to as the subscapular fossa. This subscapular fossa creates the accommodation site for the subscapularis, which is a corresponding named muscle. This is what is shown here in this image. Where at the head here, you have the serratus anterior muscle, specifically along the anterior margin or anterior lip of the medial border. So if you now go back to the posterior lip of the medial border, we have different muscles at different sub-regions. And we'll be using the posterior surface of the scapula to describe these muscles. So if you look at it, this is where we have the medial border here in anatomical position, and this is the lateral head. So if you go to the upper region of the medial border around the posterior lip, you see that it is related to the levator scapulae. And this is what is projected here in this image. So now let's go back to this image where we'll be describing how the levator scapulae runs. This is the fibers of this muscle, and you see it directed or running from the transverse processes of the cervical vertebrae. This is where we have the cervical vertebrae, and you see that they are directed inferiorly, where they are then inserted on the posterior lip or the posterior margin of the medial border. And this is what is shown here in this image. And this is why you see that the levator scapulae muscle is seen just at the upper region, specifically at the posterior margin. If you go more inferiorly, you have the rhomboid minor. This is the rhomboid minor here, highlighted in red. The rhomboid minor muscle is related to the region where we have the emergence of the spine of the scapula. Remember, this is the spine of the scapula, so you have this muscle around this region. Let's try and use this other side to describe how the rhomboid minor emerges. This is where we have the fibers of the rhomboid minor muscle, and you see it running from the lateral region of the vertebral column and directed onto the posterior lip of the medial border of the scapula. And this is how it runs here, but it is limited to just the region where we have the emergence of the spine. If you go back to this image, if you go more inferiorly, you have the rhomboid major. The rhomboid major muscle is a version of the rhomboid minor. They run in almost similar pattern, but one is major and the other is minor. For this to be major, it means it will be taking a major chunk or region of the medial border of the scapula. And this is why you see that it presents an extensive connection point. And this is what is highlighted here in green. If you try to use this other image, this is where you have the fibers here of the rhomboid major muscle highlighted in green. You see that they run from the lateral region of the vertebral column and are directed to the medial border of the scapula. Specifically, they are inserted on the posterior margin of the medial border. And this is what is expressed here in this image. So you see that you have different muscles inserted on different sub-regions along the posterior lip or margin of the medial border. And we've tried to describe them also in details. And if you go back to this alignment as shown here, we have the different muscles here indicated here in different colors. We say that at the upper part, upper region of the spine, we have the supraspinous fossa. Within the supraspinous fossa, we have the supraspinatus muscle. While inferiorly to the spine, we have the infraspinous fossa that accommodates the infraspinatus muscle. So you see that different muscles are taking different specific regions on the scapula. When we describe the anterior and the posterior surfaces, we highlighted this muscle. And in the medial border too, we try to also highlight the different muscles that are related to the medial border, both in the anterior and the posterior lobes of the medial border. So let's drive further to the lateral border. The lateral border, just as the name implies, is located laterally, and it is the thickest border. It is also referred to as the axillary border. We try to use this lower image. This is where we have the scapula here, carried in red. And this region at this lateral edge is where we have the lateral border. This lateral border, as you can see, is related to the axilla. And this is why it is so referred to as the axillary border. In the upper image, this is where we have the lateral border or the axillary border. This border is seen with distinct features. And we would be using this slide to also highlight this. If you look at the upper margin of the lateral border, we have the glenoid fossa. This is where we have the glenoid fossa here, carried in gray. This is an indentation that is created around the superior region of the lateral border. And this is what creates the accommodation site for the head of the humerus. This is what receives the head of the humerus. And this contact point creates the glenohumeral joint. Said that all we need to do is to always break down the name, glenohumeral joint. Gleno from glenoid cavity, then humeral for humerus. Using this lower image, this is where we have the glenohumeral joint here, carried in green, where you have an indentation created at the superior region of the lateral border of the scapula, fixing into the head of the humerus. And this is what is carried here in black. So you see the head of humerus that is bulged or rounded, fixed into the depression that is created on the lateral region of the scapula. And this is what creates the glenohumeral joint. There is also some distinct features around the glenoid fossa. In the upper region of the glenoid fossa, we have the supraglenoid tubercle. From the name, supra means above, glenoid, which means tubercle that is located above the glenoid fossa. So if you use this upper image, this is where we have the supraglenoid tubercle here, highlighted in yellow. This is the tubercle that allows for the insertion of the long head of the biceps brachii muscle. The biceps brachii muscle is a two-headed muscle that is located in the anterior compartment of the arm. You see that the long head of this muscle be inserted on the supraglenoid tubercle. Because we have a supraglenoid tubercle, we should expect to see an infraglenoid tubercle. So we have an infraglenoid tubercle here at this inferior region. It is infra because it is located below the glenoid fossa, and of course a tubercle. And this is what creates the attachment point for the long head of the triceps brachii muscle. The triceps brachii muscle is a three-bellied muscle, and this is why it is triceps. It has a long head, a medial and a lateral head. It is the long head that is inserted onto the infraglenoid tubercle. So you see that you have insertion point for the different muscles around the glenoid cavity. And this is where they are also helping to control the shoulder joints. It's also important for us to add that the scapula has two necks. So we have the anatomical neck and we have the surgical neck. The neck basically are constrictions that are created around the glenoid ring. This is where we have the glenoid cavity or glenoid fossa, and this is the rim here, like a tire around it. After this rim, there is a constriction here immediately after it that is referred to as the anatomical neck. This is the anatomical neck or structural neck that is carried there in black. And if you go more behind, you have a surgical neck that is highlighted here at this point. This surgical neck is seen to form an alignment with the suprascapular notch. This is the suprascapular notch here above this region. We will be describing this notch here in our next slide, where we'll be describing the superior border of the scapula. So there is a notch that is created or an indentation that is created around this region. And this is what forms the alignment here of the surgical neck. The difference between the surgical and the anatomical neck is that the surgical neck is more prone to fracture, even though the scapula on its own generally is not easily fractured because of the different muscles that are seen to be associated with it. You see that the scapula is padded up with a number of muscles. This we have described in our previous slide when we try to highlight the surfaces of the scapula. The scapula itself is padded with a number of muscles, and this is why the fracture of this bone is uncommon. But just for us to know that the surgical neck is more prone to fracture than the anatomical neck. And it is because of the constriction that is created here around the surgical neck, which is more intense than that of the anatomical neck. The lateral border also creates attachment point for some muscles. So using this image at this lower side, this is the medial border and this is the lateral border. The lateral border, we already described some distinct features, which include the glenoid cavity and also the supra and infraglenoid tubercles. So let's look at the muscles that are also related to the lateral border. So at the inferior region here of the glenoid cavity, remember we say we have a tubercle that is referred to as the infraglenoid tubercle. This infraglenoid tubercle allows for the accommodation of the long head of the triceps brachii muscle. We already described this using this upper image. So if you try to use this alignment here in establishing how the triceps muscle runs, this is what is highlighted here in blue. You see that this triceps muscle is seen at the posterior region. We say that it is a three-headed muscle. So it is the long head that is seen to emerge and be inserted on the infraglenoid tubercle that is located at the inferior region of the glenoid fossa. And this is what is projected here in this image. The triceps muscle is seen to run from the inferior region around the elbow, and you see it directed upward, where its long head will be inserted on the infraglenoid tubercle. Inferior to this region, we have the teres minor muscle. This is the teres minor muscle here, highlighted in red. So using this image by the side, this is where we have the teres minor muscle. And you see this muscle emerging from the lateral border of the scapula, and you see it inserted on the greater tubercle of the humerus, taking an horizontal direction. Inferiorly, you have the teres major muscle, and this is what is highlighted here in green. So using this image by the side here at this inferior region, you also have the teres major muscle here. And this is what is seen at the inferior region here of the lateral border. You see the fibers of the teres major also running from the inferior region of the lateral border down and be inserted around the upper region of the shaft. So this is what is projected here in this image. And you see that the lateral border also is related to different muscles around each specific regions. So let's go to the superior border, which is the last border. We try to describe the medial and the lateral border. The superior border is the shortest and the thinnest. And you see it extending from the medial angle to the base of the coracoid process. This is where we have the medial angle here. Remember, we described this angle in our previous slide. And you see it extending to the base of the coracoid process. This is the coracoid process here, arrowed in red. At the base of the coracoid process is where we have the limit of the superior border. So you see the superior border running from the medial angle here down to the base of the coracoid process. This is what is shown here using this arrow. You see that this region is the shortest and also the thinnest. We also have distinct features also around the space. So around the base of the coracoid process, we have an indentation that is referred to as the suprascapular notch. This is what is harrowed here in white. The suprascapular notch is an indentation that is created just around the base of the coracoid process. This notch is transformed into a foramen by the superior transverse scapular ligament. This ligament is what is highlighted here in black. The superior transverse scapular ligament transforms this indentation, which is the suprascapular notch, into a foramen, creating a passageway for a nerve. And the nerve that passes through it is the suprascapular nerve. This is the suprascapular nerve here, highlighted in dotted yellow. This is what passes through the foramen that is created by the suprascapular notch. If you go above this passageway, you have the suprascapular artery. The suprascapular artery is an emergence from the thyrocervical trunk, which branches from the subclavian. And you see this suprascapular artery passing above the superior transverse scapular ligament. So it is not seen to pass through the suprascapular notch. In case we are during examination, that the structure that is related to the suprascapular notch is the suprascapular nerve. It's important that we highlight this. It's also important for us to add that the acromion is related also to a muscle. So at this point, the acromion is related to the pectoralis minor muscle. So I will describe the surfaces and also the borders of the scapula. Now let's dive into establishing the angles. It has three angles, and the first one is the superior angle. The superior angle can also be referred to as the medial angle. It is medially located. But on this lateral edge here, we have the lateral angle. This lateral angle can also be referred to as the glenoid angle because this is what is related to the glenoid fossa. Then inferiorly here, we have the inferior angle. The inferior angle tallies to the point where we have the seventh rib. Remember when we started this lecture, we said that scapula runs from the second to the seventh rib. So if it runs from the second to the seventh rib, it means that its inferior angle will be at the level of the seventh rib. So it's important that we also highlight this. So these are the three angles of the scapula. Around the inferior angle, scapula is related to the latissimus dorsi muscle. And this is what is highlighted here in yellow. So now let's go to the processes. The scapula has three processes, and this includes spinous process. The spinous process can also be referred to as the spine of the scapula. And this is what further subdivides the posterior surface of the scapula into an uneven supraspinous fossa and an infraspinous fossa. This is where we have the spine here, carried in yellow. Then we have the acromion process. We said that the spine will further extend laterally, where it will become transformed into the acromion. And this is where we have the acromion here, carried in green. The acromion is what is also carried here at this inferior region. The acromion will extend from the posterior region, and this is why it is not really seen here at this lower region. This is the anterior surface. So you see it as an extension of the spine that is located posteriorly. And this is why just a part of it here is seen. It's also creating the accommodation site also for the clavicle. If you use this upper image, this is where we have the clavicle here that creates connection or articulation point with the acromion at acromioclavicular joint. We also have the coracoid process. The coracoid process is what is carried here in this upper image in blue. If you go to this lower image, it is seen more in the anterior region. So this is the coracoid process. This coracoid process is seen as a beak-like or hook-like projection that is seen around the glenoid ring, around the neck of the scapula. The coracoid process is seen to connect with other structures around the shoulder joint. So we have the coracohumeral ligament. We said that all we need to do is to always break down the name. Coracohumeral ligament is a ligament that connects the coracoid process to the humerus. And this is what is highlighted here. So you see a ligament connecting these two structures. Then you have another ligament that is referred to as the coracoclavicular ligament. Coracoclavicular ligament is connecting the coracoid process to the clavicle. This is where we have the clavicle here highlighted in white. And this is where you have the coracoclavicular ligament here highlighted in dotted red. And you see it connecting these two structures. You also have the coracoacromial ligament. This is where the coracoid process is connected to the acromion. This is where we have the acromion here at this posterior region. So you have the coracoacromial ligament highlighted in dotted green, also connecting these two structures. This is to further create structural connection with the structures that are located around it. So let's look at the blood supply. The blood supply of the scapula is extensive. So you have branches from different vessels coming together to form anastomosis around it. We have the suprascapular artery. The suprascapular artery is an emergence from the thyrocervical trunk. And we know that the thyrocervical trunk emerges from the subclavian. You also have the posterior circumflex humeral artery that branches from the axillary artery. We know that the axillary artery is a branch from the subclavian artery. We have the circumflex scapular artery that also emerges from the subscapular artery, which emerges from the axillary artery. Axillary artery is a branch from the subclavian artery. Then we have the transverse cervical artery that emerges from the thyrocervical trunk. We know that the thyrocervical trunk branches from the subclavian artery. All these arteries are seen to network themselves, creating an anastomotic network around the scapula. And this is what provides the blood supply to the scapula. So let's look at clinical anatomy. We have the shoulder sprain. Shoulder can sprain, and when this occurs as a result of overstretched or torn ligaments around the shoulder joint. We also have fracture of the scapula. Fracture of the scapula is uncommon, and we've tried to explain the basis behind this. We say that the scapula is padded with a number of muscles. Remember when we described the different sub-regions of the scapula, we highlighted a number of muscles that are related to it. Even within the scapula itself as a structure, we have subscapularis, infraspinatus, and supraspinatus, helping up to pad up this bone. And this is why the fracture of the scapula is uncommon. Thanks for watching this video. Let's continue to stay glued to this channel.